everyone. Thank you so much for joining us today. My name is Tessa Bratchard and I am at the marketing department at Mercy One North Iowa. And today we are so excited to talk to Dr. Kaul, our pediatric neurologist here at Mercy One. And with that, I'm going to turn it over to Dr. Kaul. Oh, shoot. There it goes. All right. All right, Dr. Kaul, do you just want to introduce yourself?
Hi everyone, good afternoon and a warm welcome. We're so excited to do this Facebook Live event here at Mercy One North Iowa Medical Center, and I'm Dr. Kaul. Let me tell you something about myself. I'm originally from India. I trained in Houston and now call Mason City home since the last 9 to 10 months. I've loved the city. The love and support we've received from the community is incredible. And I'm based at the West Campus here in Mason City, where I see patients with child neurological conditions, a wide spectrum of things that we see in our clinic, including headaches, Tourette syndrome, tics, neurodevelopmental problems, a broad variety of patients, but my passion lies in autism spectrum disorder, and we do see a lot of autism patients in our clinic as well. Overall, it's a very rewarding job, but what I really like about the field of child neurology is when I hear families say that we've made a meaningful impact or difference in their child's life. I don't think anything can be more rewarding than that. We're living in, I would say, challenging times, different times. We have a new normal, so to say, with the coronavirus pandemic. Families are spending a lot of time with kids at home in the role of primary caregivers and educators, so we wanted to do this event to make sure if we could answer questions and address things that can be noted from a neurodevelopmental standpoint of view, which parents have questions and concerns about. So that's the main reason we decided to go ahead and do this event, to be here to answer questions and concerns that families might have noted now that they're spending more and more time with their kids at home. Let me go ahead and start by talking about coronavirus, COVID, in the pediatric population, and then what we're seeing from a neurological standpoint of view. When coronavirus started, there was a thought process that we're not seeing a lot of pediatric cases, and to an extent that stands true even now. When you look at the overall population that's been diagnosed with coronavirus in US and across the world, about 2% of the population that has been diagnosed falls into the pediatric category, which is less than 18 years of age. So, that's how we were hearing, asymptomatic carriers, not seeing a lot of pediatric cases. However, interestingly, as it's an evolving disease, we are learning about coronavirus every day. New data keeps emerging. We now have realized that there are some unique presentations or manifestations that are being seen in the pediatric population. Things you might have read about in papers or, news media on your local news channels is dermatological or skin manifestations. The first thing that has been uniquely now described is called as COVID toes. There is a presentation of a rash, which is reddish, bluish discoloration of the toes and the bottom of the feet. Similar kind of rash had been seen in kids with measles, but there has been a suggestion that a lot of patients, particularly I'm talking about pediatric patients, have this presentation of COVID toes. Interestingly, as recent as this morning, the CDC released a new statement about this pediatric multi-system inflammatory syndrome, which now has been noted in the pediatric population. What you might have heard in news is data coming from New York that there were about 15 kids who were admitted to the hospital in the ICU level of setting with these immune-mediated or a multi-system presentation. So what does the pediatric multi-system inflammatory syndrome mean? It essentially, when you break it down, means that your immune system is being attacked by inflammation in your body. Multi-system meaning that it involves a lot of organs. So common organs involved is your blood vessels, your kidneys, your gastrointestinal system, heart, and neurologically. Other thing you might have heard is Kawasaki disease and pediatric patients and COVID. So Kawasaki disease is again an immune-mediated inflammation of the blood vessels that results in high fevers, it results in rashes, particularly red rashes that break out on your skin. You may have what is called a strawberry tongue appearance, and then inflammation, fatigue, weakness, lymph node enlargement. We do know with Kawasaki disease what we need to be worried about, or at least watch closely about, is something called as aneurysm, which is dilatation of your aorta, which is one of the major heart vessels, which can lead to complications. So that's why it's important that we keep a close eye on these symptoms. The treatment for this is immunoglobulins, immune-mediated medications. So a Kawasaki sort of illness has been seen in pediatric population associated with COVID infection. The most important thing I want to highlight is that if you're worried about any symptom in your kid that is unusual, please do not hesitate to seek attention. Your providers are here to provide you care. Talk to your providers. Here at Mercy One, we have developed ways to triage patients. I'm very glad to say that our telemedicine services have expanded rapidly, and we have a system where we can see you. If you're worried about coming in personally, we do have way to triage you, see you by telemedicine if we seem it's appropriate, and even if you have to come into a sick clinic or the ER, we have adequate safety mechanisms here in place to ensure that we are able to provide you safety. So again, as I was saying, please do not delay care for any urgent need, including vaccinations. That's something which is important as well. Let me switch gears and then talk about neurological things that have been noted with COVID. This is not specific for pediatrics only. Again, remember, data is limited. We only know little about it. But neurologically, what's been interestingly seen in these patients who are COVID positive is they have, as early as what we've known, they've been noted to have loss of the taste sensation and loss of sensation of smell. That was the first thing that came out, and people were really curious. They were trying to find why was the case. So those were the first neurological symptoms that were noticed in COVID positive patients. It was almost thought that you don't see a lot of neurological symptoms in these COVID patients, but now that we know more about COVID, we realize that about 40 to 50% of the patients may have neurological symptoms. Younger patients presenting with stroke-like symptoms, not the mechanism being hypercoagulability, meaning that the blood in your body or your brain is excuse me, clotting in a way differently and presenting with early stroke symptoms. Always in the case of stroke, remember the acronym FAST, that is facial weakness or facial droop, arm weakness, and then slurring of speech, and most importantly, time is critical, time is money. Other symptoms that have been noted is what we now are describing as COVID encephalitis. encephalitis means inflammation and swelling of the brain. These patients may present with a variety of neurological symptoms: confusion, lethargy, seizure-like presentation, or altered mental status. Other thing that we found or know about is presentation of what is called Guillain-Barré syndrome. It's an inflammatory process where inflammation or cells from your own body attack the nervous system, leading to weakness, which is ascending, meaning going from, generally from bottom up, and can eventually lead to respiratory failure. Headaches and seizures have also been seen in these patients. Again, broad spectrum of symptoms. The crux of the line is any acute presentation, any acute symptoms, please seek care, because these conditions can lead to long-term health implications. And that's where I'll stop. I hope all of you are maintaining and helping us mitigate this virus, the spread of this virus, and staying at home healthy and safe.
Okay. And Dr. Kaul, now that parents are home with their kids more, what are some just general things to look for? I know you do a lot with headaches in children. Can you kind of expand on maybe what parents should be watching for?
Absolutely. So, now that kids are home with parents, parents are in role of primary caregiver, educators, you may notice either new development of headaches or increased worsening of headaches. That something can happen. Anxiety and stress around the uncertainty of the coronavirus, and overall canceled events like practices, graduations, summer plans. That's something that we, at least I have seen in our clinical practice. Neurodevelopmental issues, because kids are with families for a longer time, noticing developmental delays, or picking up the subtle developmental issues, or tics development or worsening of new tics. Those are things that are some things that the parents might be noticing as they're spending more and more time with kids at home.
Sure. And Dr. Kaul, why would a parent take a child to see you, a pediatric neurologist, versus maybe a family clinic? Can you kind of explain the difference there from a parent standpoint?
I think that's a very valid question, and something that comes up often in parents' mind. The way I like to think is, if you're worried about any symptom where you feel, let's take example of headache. Your child has had headaches for some time. You've talked about it with your primary care provider, your regular doctor. We've tried simple things as over-the-counter medication, and things still are not quite moving in the right direction, or the headaches are worsening, or there are other symptoms associated with the headaches, what we call as red flags.
Mm-hmm.
It's just not headaches that come once in a blue moon, but these are headaches that are occurring multiple times a week, leading to impairment in your activities of daily living, clearly causing a deviation from your routine lifestyle, or needing multiple medications over the counter. Those are times when you start thinking that, do I need to see somebody just more than my regular primary care provider,
Sure,
who could give us more insight from either a lifestyle or a medication standpoint of view? That's something I'd like to say.
Yeah, thank you. Okay, now we're going to go to the Q&A, and we just want to say thank you to everybody who submitted a question. Anytime during this next 15 minutes, if you have a question for Dr. Kaul that you think of, please comment it in the live, and we'll try to answer it if time permits. Dr. Kaul, our first set of questions actually is, my child has developed a motor tic the last few months. She is 5 years old. What is normal versus abnormal for tics? When should I bring my child to see a neurologist or be concerned? Can stress and anxiety cause an increase in tics?
This is a great question. I think this viewer asked several questions in one question, and I'm glad that this came up in a way This is something that we very commonly notice in the pediatric population. What I feel is going on with your kid is the kid is having a tic disorder. What is a tic? A tic is a sudden, repetitive movement. The movement can be either, a sudden twitch of an extremity. It can be a common motor kind of a tic, which often people think of blinking of eyes, shrugging of shoulders, kind of, or a vocal tic, meaning making some unusual sounds. Tics are actually very common in the pediatric population. About 1 to 5% of kids can have tics. Now these tics actually can present in various forms. They can be what we describe as the motor tics, the vocal tics, or you could have both of these varieties of tics. Depending on how long the tics have been ongoing, we then classify them into provisional tics, we call them chronic tics, and then I think quite often you hear something called as Tourette syndrome, when you had a combination of motor and vocal tics that have been ongoing for more than 1 year. So what it seems like your kid has developed a type of motor tic. Answer the second question you ask about, can stress and anxiety exacerbate? Absolutely yes. Stress and anxiety are known to kind of increase the severity of tic. Emotions, both positive and negative, can increase the severity or bring about new tics. That's something that we often notice. Again, also I'd like to say that every tic does not mean that there's something very abnormal going on with your kid. I don't like to use the word abnormal when I'm thinking about tics or any presentation, so to say, because we do see them in a lot of pediatric patients. And what's most important is, one, recognition of the symptoms and addressing why you're seeing these symptoms. The other thing you notice with these tics is quite a lot of these kids do have other comorbidities called, like anxiety, ADHD, OCD, depression. We commonly notice them as well. Every tic does not mean that you need a medication. If the tics are not causing significant impairment in your day-to-day activities or lifestyle, or doesn't have a significant burden of tics, we often like to counsel families. And for families, it's very reassuring to know that this is a tic, and once they know that it is a tic and they feel more reassured, often families are not as worried about them. So talking with your providers, if you need to see a specialist in case these tics are not in control or progressively worsening, are options that you may have. Medications options are always available, but beyond that, role of therapy, cognitive behavioral intervention for tics is something that has been described in the literature and very well known to be effective. So that's all I'd say about tics, but to answer your question in a snapshot, yes, seems like your kid has a motor tic. Anxiety and depression and stress can increase these tics, and it's a relatively common thing that we see as a pediatric neurologist, and it's a clinical diagnosis. Your kid probably does not need any imaging or any further testing if there are no other causes that can be leading to presentation of this tic. And I hope this answer is helpful.
Thank you, Dr. Kaul. And this parent that submitted this question, she can come see you at the clinic here?
Absolutely.
Okay.
And if you're worried about coronavirus, let me also fill in that we do have capacity to do telemedicine consultations. We're doing all our consultations as telemedicine, determining what's going on before we even decide to bring somebody to the clinic. So be reassured that if you need to see us, we are able to offer telemedicine consultation.
Excellent. And we just had Eric pop on to the live here with a question about where our office is located.
Okay, we are located on the West Campus here at Mercy One. I am in the Pediatric and Adolescent Clinic. We're at 910 North Eisenhower Avenue, Mason City, Iowa 50401. And,
Woo! You're becoming a true Mason Cityan.
No, and our office number is 641-428-5437. Please reach out to us if you have, if you'd like to see us, or if you Google us, you should be able to pull our information, or if you call our Mercy main line, they should be able to connect you to the right people.
Right, and this parent wants to come see you. It's insurance covers it, and it's the same kind of charge as seeing a family provider. Is that correct?
It is insurance. Your insurance should be covering a visit. There is, like you would be having a copay for your other healthcare providers. There may be a copay, but we always have options here. And also remember, for families who are not insured or are struggling with insurance, we do have our charity care who can help you with it. Again, do not let thoughts of insurance limit you in a way to seek care and attention for your child's needs.
Thank you, Dr. Kaul. Okay, we're going to move on to the second set of questions, which is kind of long, so I'll just kind of summarize here. I have been struggling with my now 15-year-old daughter for years, trying to get a diagnosis to help her. Currently, her symptoms seem to be worsening, and no one will help us get a diagnosis. I'm wondering if she is on the autism spectrum, or if it's due to a lack of some type of vitamin causing her symptoms, maybe a hormonal imbalance, or should I be concerned about a brain tumor? And these are some of the things that she experiences. She currently wears at least 4 t-shirts, a football jersey, and a winter-type vest all the time. A couple weeks ago, it was 2 t-shirts, a raincoat, a sweatshirt, football jersey, and a winter vest. Note, we are doing therapy. She wears a stocking hat all the time. She won't brush her own hair at all, doesn't care how she looks, constantly sniffing soap, dish soap, hand soap, bath soap, and laundry soap, won't sleep in her bed, has to constantly tell me she loves me every 2 seconds, practically sits on my lap and must hold my hand all the time, follows me around like a shadow. She has no desire, to do her homework, to talk to her friends, to do anything around the house, just has no desire to really do much of anything. Let's see. So this parent's asking, how do I get a doctor to listen to me to help get a diagnosis? We have seen therapists, regular doctors, pediatricians throughout the year. Any help or advice would be so welcomed.
I'll take a pause and we'll start by saying to this mom, we hear you. It seems like you've had a very bumpy journey to where you are right now, and though I don't know how you feel, I can say that we're here to try to answer these questions for you. To start with, I may not have all the information, but seems like your 15-year-old daughter is struggling with a lot of sensory issues. Often people think that sensory issues equals to autism spectrum disorder because majority of symptoms or a major chunk of symptom in autism spectrum disorder is sensory in nature, so to say. But it's important to know that autism spectrum disorder is beyond sensory problems. It is restricted, repetitive behaviors and problems in social communication, interaction. Despite of it, the most important thing is trying to sit down and doing a comprehensive evaluation and breaking down the symptoms to have a more in-depth understanding of are the symptoms that you're describing. We gave a very comprehensive list. This is something we do, in the clinic. taking hours at time to sit down and break it down, that whether the symptoms are purely sensory or there are issues beyond sensory in nature, meaning social communication problems and other restricted repetitive behaviors. It seems like you're doing the right thing. You said you're seeing therapist. I assume this is occupational therapy, so that's something would or should be helpful. But to me, it seems like sitting down and having a detailed evaluation of what the core symptoms are, what are the big challenges, and how do these symptoms affect the day-to-day functioning and activities of daily living, functioning at school level, functioning in the social context, and what other things are going on to kind of help determine how can things be more helpful. I also heard that you said that you've seen psychologists. Other thing that I would think about, or the question that comes to my mind, is that if you've seen a psychologist, what is being done? Is this more of flavor of counseling, or has this been a psychological evaluation? What were the results of the evaluation? And then trying to put all the pieces of the puzzle together, because remember, it's not one piece or two separate pieces. It's putting all those pieces of the puzzle together to come up with a diagnostic evaluation or diagnosis. I hope that helps. And again, as I said, I hear you, Mom. It seems like this has been a long, difficult road for you, and I hope that this answer helped you in certain ways.
Thank you. Yeah, it seems like it's been a long, hard road for her. She did mention a little bit about autism. Can you kind of go in and talk about autism just a little bit and the testing we do here? I know in a lot of places there's a long wait to get an autism test. Isn't that right? Is that right?
That is correct.
Okay.
That is correct. So as I've said that I love being a child neurologist. It's a very rewarding job. But in the field of child neurology and overall as a physician, my passion lies in autism spectrum disorder, trying to bridge the gap, early diagnosis, and making sure we're connecting family to community resources is something that I'm very passionate about. So autism, I feel that it's been so-called in this box of neglected issues overall in medical care. Autism is a neurodevelopmental disorder. It's characterized by, problems in social communication, restricted repetitive behaviors. It's actually very, very common. The recent data released in March by CDC says that 1 in 54 kids in this country, in USA, is diagnosed with autism.
Wow.
So it's not something which is, novel or unique. This is very common. 1 in 54, as I said, kids in US is now diagnosed with autism spectrum disorder. What's most important is that we now know that early intervention is the key, meaning we're trying to bridge the gap between the time to diagnosis and starting interventions, and that's where the big challenge lies. Time to wait to get a diagnosis can range between 6 to 9 months, and speaking from our experience here, the University of Iowa Center of Developmental Disability is so backed up that they may have a waiting for about a year. They do comprehensive evaluations by neuropsychologists, but what we're able to offer here locally is that we do autism diagnosis and we do have the capacity to do the evaluations here to get early diagnosis and the early diagnosis kind of translates into ensuring that these kids who need early interventions, and interventions meaning ranging from speech, occupational physical therapy, behavioral therapy, applied behavior analysis, we can get those processes started early on, because there's one thing we certainly know about autism is that early intervention is the key. So my passion lies there, trying to bridge the gap, getting kids diagnosed early and making sure that we're able to connect them to resources here in the community. And overall, our goal here at Mercy One and our community members is to make sure that we are, narrowing the gap between the families who are struggling with kids and their health needs and the resources that we have in the community.
Sure, great. And just one last question here before we kind of end. Parents are at home, kids are at home, the mental health aspect of all of that. Do you just have some advice for parents, for themselves, and for their kids to, keep busy and keep positive during this time as we're all stuck at home?
I'm going to start by saying the disclaimer that I am not a parent, but I read a lot about it, so these are few things I recommend when I talk with my own patients and my family members, my nephews and nieces. First and foremost is acknowledging. It's okay for us to talk with our kids openly about what's been going on. This is what I call as a historically challenging times. I also say once in a lifetime occurrence what we're living through. So it's okay for us to discuss what's going on with the kids, and likewise, if our kids have questions, entertain them and encourage them to ask questions, because talking is helpful. Kids are living in these times when schools are canceled, they're doing online classes, not able to keep up with meeting with friends, grandparents, families, missed graduations and summer plans. It's a lot. So the one thing I say is talking about what's going on, and talking at what is appropriate for age, and then overall keeping a positive environment, making sure you're doing fun recreational activities safely, and then I also say focusing on the positives. I always say at the end of the day, talk about one positive thing or one happy thing you did, so that you can keep the wheel moving in a positive direction. And then also acknowledging the unknown, the uncertainty that kids might be expressing, and letting them talk about it. There are counselors who are offering services by telehealth or virtual visits, so there are options to explore just beyond talking with your kids if they need more help, just than talking with you guys.
Thank you, Dr. Kaul, for that. I know it's just been a challenging time for everybody, and we're all kind of getting stir crazy, so just keeping that positive momentum going is great. And with that, do you kind of just some ending notes at all before we close?
Thank you so much for giving me this opportunity to speak with you. As is with all the providers, we here at Mercy One are here to help and care for you. The most important thing is making sure that if you or your family members or loved ones need any care or immediate attention, health attention, please do not delay health care. And even for conditions which are not acute but might need some care, we are here to offer services by telemedicine, here to kind of help answer your questions and queries. Hope you guys are staying home, healthy, safe, and yes, wearing masks. Hope you guys have a great weekend. Thank you for having us here.